Hey guys, welcome back to another video. In this video I'm going to show you guys how I start an IV using the Nexiva product. First thing you want to do is make sure you get the most appropriate gauge for the patient. The smaller the gauge, the bigger the needle. Based on the patient's vein, you want to choose the most appropriate gauge. In this one we're using 20. So the first thing you really want to do is have the patient's arm isolated, elevated, and in front of you, like so. And then what you want to do is pull up a tourniquet and tie the tourniquet in a way that you can easily and quickly take off the tourniquet. So you can see here she ties the knot so that she has a strap so she can easily pull, and that will easily release the tourniquet. You definitely want to make sure that the tourniquet is tight and it restricts blood flow so that the vein is nice and big and juicy for you to insert. Alright, so next you want to move the patient's arm so that it's easily accessible and you're comfortable, and basically tell the patient to make their arm into a fist like I'm doing. And sometimes nurses kind of slap the vein that they're trying to insert so that it comes out more and it makes it easier to insert. Then you want to go by your hospital policy's guidelines. Our hospital indicates that we use some chlorhexidine and you wipe around that area. So just continue telling the patient to make their arm into a fist so that it's much easier for you to insert. Next, you want to grab the patient's arm and look at the vein, and what you want to do is make sure that when you insert, you hold the vein down and almost tight so it doesn't move around. You see how the thumb is on the vein, making sure it doesn't move. You want to make a small incision, then turn the bevel downwards and pull the metal pad out as you're inserting further. Then you want to release the tourniquet and apply the tegaderm bandage like so. So after you've placed the tegaderm on the IV site like so, you want to make sure that you date and put your initial on the IV so that they know when it was inserted, as it needs to be recited every few days based on your hospital's guidelines and policy. And you want to make sure that you put the syringe tip at the top so that other people can easily flush it. And of course you want to flush it to make sure that the IV site is working before you leave the patient room. After you've inserted the IV and you've left the patient room, making sure that the vein flushes normal saline or whatever you guys use at your hospital to flush, you want to make sure that you document on the computer system that you inserted it and where exactly it is. To remove an IV site, it's very simple. You just hold the pink bevel down and remove the sticky adhesive bandage around it. In this case, I was dying because I have a lot of hair on my arm, which happens to a lot of patients, unfortunately. And then you basically grab your bandage, your gauze, and put it right behind where it's inserted, and just quickly remove it and apply the gauze and secure it with tape. You ask the patient to hold it down further and make sure that they apply pressure to stop the bleeding. So once you've discontinued the IV site, you want to go ahead and chart where it was that you discontinued, and that's it. You're done. If you like this video, please consider subscribing for more content like this. Comment down below if you found this video helpful, and give me a thumbs up on the video so that other people can find it as well. Thank you very much for watching, and we'll catch you in the next video.